Treatments of OCD, CBT, exposure and response. What is CBT? CBT is based on cognitive as well as learning theories. It addresses thinking and behavior involved in OCD. Obsessions are negatively reinforced by avoidance. Compulsion rituals are associated with anxiety. The client usually engaged in 30 to 20 sessions with monthly follow-ups. It can be done through group therapy, self-help books, online, family therapy, or structured activities. Patient-therapist relationships are important, and focusing on the therapist being non-threatening and supportive. CBT involves examining the things you do, think, focusing on goals and the present day, and how your thought affects your feelings and behavior. Response prevention (RP). This is based off classical conditioning. The client is taught that the obsession that previously created anxiety is no longer produced this response. They are prevented from engaging in compulsive responses. List/rules are often given, i.e., only vacuuming for half an hour a day. New routines are provided to restrict the compulsive behavior. Exposure. An individual is presented with fear until anxiety reduces. The fear is presented in a hierarchy from least to most threatening. Relaxation techniques are taught to use outside of therapy. So if you don't know what DESERT is a useful way to evaluate treatments. It stands for direct, effective, side effects, slow/fast, ethical, relapse rates, and types of people. Direct. The therapist leads the process, setting structured tasks such as exposure and response prevention. They challenge the patient's thoughts and behaviors, guiding them step by step, whilst the patient actively follows instructions. This directly challenges their behavior. Effective. ERPT would not be effective for those without compulsions. However, therapy has been promoted as the first choice by NICE, and it's effective in reducing symptoms and can be applied flexibly. Improvement in 50% of cases, but the effectiveness is increased by combining with drugs. And POTS 2004 found that CBT is more effective compared to drugs. However, it was proposed that this was due to the therapist. Slow. Now this is a slow treatment. It takes 30 to 20 sessions with follow-up. Some people cannot cope with the effort and distress involved. Success depends on the client. It may be beyond the client's power. CBT may be unable to help people without the use of drugs alongside it. Ethical. It's high in ethics as it allows the person to take control of their own treatment. However, it could lead to discomfort due to having to face and be exposed to their anxieties and constantly try to resist their obsessions. Relapse rate. 50 to 60% of people who complete ERP treatment shows clinically significant improvement in OCD symptoms, and treatments shows to have maintained a long-term effect. Types of people. It's not effective to type of people who do not have compulsions, which equates to about 44% of people with OCD. It only works for individuals who are motivated to change. It requires a lot of personal input, time, and attention.